Hi everyone, welcome to Letter Media's sit-down forum. In this respect, we're taking a look at the coronavirus and the things that we are hearing, the things that we're speculating. We want to put all that to rest here today, and we have some specialists with us to help. To my left, we have Ben Avery, who is with the Ross County Health District. He is the administrator. Michelle Long, the director of nursing. Also Dr. Christopher Brown, our health commissioner and also medical director for the Ross County Health District. And to my right from Edina Health System, we have with us Dr. We call him Will Hadar. He is the doctor with infectious diseases. Also Amy Robertson, the director of quality control and services as well. Let's begin first by stating what the coronavirus is, Doc, and let's see if we can at least lay that out on the table and we'll go from there.
Sure. Coronavirus is a virus that we've known about for a long time, since the 60s. The word corona actually in Latin means crown, and that's how we used to see it under the microscope. Previously, coronavirus causes about 10 to 30% estimates of the upper respiratory infections. And we have that in the community all the time. But the virus evolves and they change the strains, and then it becomes a new virus. And historically, back in 2002, 2003, we had SARS, which is the form of coronavirus that caused a severe lung infection, which was very severe, but it didn't spread as fast. And then in 2012, we had what we called MERS, or Middle Eastern Respiratory Virus, that also was pretty severe, but it didn't spread. And most recently, what everybody's hearing about is this new COVID-19, which first came about in China in probably November or early December of 2019, which is basically another coronavirus, and it caused similar symptoms, but it's new and our body is not immune to it yet.
When we're hearing of deaths, one's too many, but we have seen over the years 80,000 people nationwide dying by the flu every year. There's a great deal of concern and panic that has set in from what the media reports have been in regards to this. So what we want to do is we want to not dispel all the rumors, but to at least kind of tone them down a little bit. Would you agree, Doctor?
I would definitely agree. Kind of like Dr. Hadar said, this virus, family virus, I guess, has been around for quite some time. I think that the fact that we have a new strain is probably ramping up a lot of anxiety. But kind of like I said, we're as we look at these deaths, one is too many, but we want to put that within a perspective or a context to make sure that we have realistic expectations about what is actually going on.
And as we're recording this on March 3rd, we have no reported incidents here in Ohio at this point.
That is correct.
But if we do get them, Adena is prepared to handle the treatment. Let's talk about Informational Site, though. Let's get to that first. So, Ben?
Absolutely. Yeah, the Health District stands ready to provide information to the public on this issue. We believe that there's no need to be fearful of the coronavirus, but what helps combat fear is knowledge and preparedness. So that's kind of why we're here today, to try to provide some knowledge on the coronavirus and talk to people about ways that they can prepare should this show its face in our community.
When it comes right down to it, knowledge is power.
Absolutely.
So if we learn the difficulties about this virus, then we can better easily handle it along the way.
Absolutely. And we are going to be treating this very similarly to what we treat our response to the flu virus in Ross County. We do epidemiological investigations on a regular basis. Michelle is actually the expert here, but this is not new to us in terms of, investigating illnesses, diagnosing them, isolating patients, and then doing contact tracing. That's how you control the spread of infectious diseases.
And Michelle, it wasn't long ago that we were worried and concerned about the H1N1
Exactly.
in that regard. So we've kind of walked this step before, haven't we?
We have, and we just want to assure the community that, we do this every day, that, we're going to remain calm. We are monitoring it. We're in communications with CDC, ODH, our partners at Adena, on a daily, weekly basis pretty much, we're talking to someone about this. And we do surveillance every day through Ohio disease reporting systems, through syndrome surveillance. There are a lot of things that come here, and there are over 100 reportable diseases that we actually investigate every single day. So, and it's kind of a hidden thing that we do at the health department. Unless you are on the front line of being diagnosed with something, then you really don't know that's what we do behind the scenes. And so we do this every day. So we will treat it that way. You know, when we have a rise in something, if there's an outbreak, then we try to be very proactive and get ahead of that. So that's what we're trying to do. And we just want our community to know that, you know, we're ready for this. We know how to do this. We've done this before.
As recently President Trump talking with the pharmaceutical companies trying to speed up the process, it could be a year or so before we actually come up with a vaccine for this, correct?
Yes, that is correct. I mean, there's a process to get into vaccine. First, you have to get the virus, and then you have to strip it from its virulence and then experiment with animal. There's 3 phases to get a vaccine. So a year to up to 18 months is an average of how long it takes us to come up with a vaccine.
In the meantime, what sort of things can we do? Do we need to go out and buy masks? Do we need to do that? Is that extreme?
At this point in time, the biggest thing, in terms of the masks, no. Please. You know, I think that, both on the federal as well as state level, everyone is telling everyone not to go buy masks. I know you see TV and you see everybody wearing the mask. But, you know, number one, a lot of these surgical masks are not effective. Number one. Number two, like I said, the healthcare workers do need those, and like I said, you can run a shortage if too many people buy those masks at the same time. And kind of like Ben said, I mean, like I said, for this, I mean, one of the things we're encouraging people to do is really hand washing. You know, so washing your hands, like I said, avoiding touching your eyes. If you are sick, stay at home. So those sort of things, what we call cough hygiene. So instead of coughing out in the open, cough into either the elbow or in your hand, and then wash your hands. So those kind of really kind of public health preventive measures are what we're encouraging people to do right now.
The stay at home from work is very key because so many of us can do work from home these days. What other tips do we have in that regard?
To stay home, I was sitting here thinking, I don't know how I would stay home right now. There's so much going on with coronavirus. But, that's why we're trying to get ahead of this. There's a lot of guidance out there for schools, a lot of guidance for employers to start looking at, what would happen? We prepare for this like we're going to prepare for a trip, or we're going to prepare for snow in the wintertime, and we need to put things in our cars like blankets and flashlights. So, we need to prepare for this. What would that look like? Not that we have to panic, but if that came, what would that look like? How do we prepare to stay at home? Do we have apps on our computers and things, and have we thought about, what we can do at home and work that out with our employer? I think the schools are thinking about it. They're thinking about how could they, with the kids having Chromebooks, how could they, set that up. So I look at this as, don't panic, but you can prepare. Do you have 14 days worth of food in your home that's, non-perishable? Just those kind of things. Do you have cold medicine or anything you might need to help you get over some of the symptoms? But again, this is not just coronavirus, but definitely just flu and cold season. So just staying home when you have those things, because obviously if your whole office or workplace gets sick, then that's definitely a problem.
And if you're going to the supermarket or whatever, you run the risk of running into someone who does have it, and so you got to get your provisions just to be indoors for 14 days or so.
Correct.
As far as Adena, and I'm going to give you a lot of kudos because shortly after the new emergency room was opened up, we had a serious circumstance here in Ross County, and Adena was prepared for that.
Yes.
How are you preparing for this?
We are prepared, and we actually tested that process. We early screening for in triage for travel, and then symptom screening. And then if it meets that criteria, then it's isolation. And then we contact our local health department to see what testing's recommended. and treatment as far as that goes, and then how we want to proceed with the treatment for the patient, whether they'll be going home or if it's an increased level of care that is needed. So I feel like we're prepared.
I think one of the hardest things about this is it's ever changing every single day. And it is really hard to keep up with all the guidance that's coming, not only at a national level, but then at a state level, and then trying to work with the healthcare system to make sure that, you know, there's a public health component to this, there's a hospital healthcare component, and it's just, there's a lot of reading and a lot of doing while this is all going on. So I think we're all working very well together. We've already been in contacts about different things and making sure we're prepared and we know what to do. And I think we've got a great partnership here to work through this no matter what comes our way.
These are some of the things that we do every day. These are your basic infection control measures that we already have in place in policies, procedures, and you know, that's just identified in the way that we handle these types of incidents that happen. So I just want to say, along with hand hygiene, staying home when you're sick, it's not just for coronavirus, it's for every kind of illness that you would see. So just making sure that we are following those policies and procedures that we already have in place that are best practice.
Clearly, knowledge is key, and that also pertains to the medical staff. You know, so we've trained our medical staff how to properly screen, what to do if they have a high-risk patient or somebody that they're suspicious of, how to, you know, to go from point A to point B, how to do this. So all our medical staff are very well versed in this, how to deal with it, and whether it's from EMS to our urgent cares to our outpatient clinics to the emergency department, everybody is on board. We have protocols. We know how to pursue this, and we know how to deal with it if the issue arises.
If you are not feeling well, at what point in time do you say, okay, this has gone a little further than what the normal flu might be?
Right.
How do we handle that situation?
Well, clear from a medical perspective now, we're talking anybody, viral infection is a spectrum. Some people can be barely symptomatic with just fatigue, tired, feeling under the weather, to somebody that is severely ill, maybe shortness of high fevers, very short of breath, coughing, even altered mental status, and so it's a spectrum. Clearly, if somebody is just feeling a little bit of a runny nose, sore throat, fatigue, some joint pain, just symptomatic relief, and keeping yourself as possible from infecting other people, and just staying home. Bed rest is very important for your immune system to fight infections, and proper hydration. So that's, if somebody clearly is sick where they think taking care of yourself at home with just Tylenol or over-the-counter medication is not cutting it, and I'm having very high fevers, I'm having trouble breathing, I get lightheaded if I get up, I'm having some signs of confusion, anything that is beyond this typical respiratory symptoms, then clearly they need to seek medical attention.
We're encouraging people to call in first so that we can do the travel screen even before they're on site. And telemedicine is also a piece of that as well. You know, if you want to call in and do that first, because obviously we want to limit exposure, and we're just following the guidance. You know, that's ever changing, and we do collaborate with a weekly huddle with our local health departments and then stakeholders within the hospital, so that we're all on the same page as far as communication and what's new and happening for that day or that week, so that everybody's prepared.
True or false, whoever wants to handle this, it's too late to get a flu shot, and if I got a flu shot in September, is it still going to help me?
Well, it's two questions. It's not too late to get a flu shot, that's for sure. And if you've got it in September, it's still as effective as if you'd have taken it in December or in November. So I don't know how can I answer with a true or false, but the answer is please get your flu shot if you haven't. It's very important, and it's if you've taken it this season, then it's still effective.
That's good enough.
I think it's also important to add that if you've gotten your flu shot and we start to see increasing numbers of people with coronavirus, that'll be that number or less of people that are visiting the emergency room, it's going to be freeing up space for patients that actually need to see attention. So we would encourage you to still get the flu shot.
If anyone has any questions, they can certainly give Adena a call and also the health district.
Yeah,
Right.
absolutely.
Right. Exactly.
We've been taking our cues from the CDC and ODH, so you can also visit their websites if you want more information. But here in the community, if you're a business that wants to, some visual information to display, we'd be happy to help you out with that. Anything that we can do to help get the facts out about coronavirus would be great, and we'd be more than happy to help with that.
Yeah, and while we have large employers here in the county, we've got a lot of small businesses that have, maybe 30, 40 people on their roster, and you folks can help in that area.
Absolutely.
Educationally.
Yeah,
Exactly.
and the Ohio Department of Health has a dedicated website, www.coronavirus.ohio.gov, and it has all the information and is updated daily at 2 o'clock in the afternoon. So, I think people need to, if they're going to educate themselves, to really make sure they're getting something credible and making sure that it's coming from the CDC and Ohio Department of Health at this point.
We need to take in consideration, some of those community members that might be at a higher risk for this virus, and anything that we can do to reach out to them. If we're in a situation where we're in a position to help, we need to be thinking about who those folks are that are at risk and that may have special needs, to keep those folks in mind too as we're going through this flu season and potentially the coronavirus as well.
Yeah, I was thinking kind of the same thing, your neighbors and different people that may be, alone and not have any family or anything. Just getting to know them, not that this should raise any awareness, but, if they were homesick for 14 days, would they have somebody to bring food to their porch or to drop it off? So as a community, we can all support each other and try to help each other through this, and just go from
And
there.
you can bring that meal and sit right there at the door, knock on the door, and not have to worry about exposing yourself.
Exactly.
We can
So-
take care of each other.
Yeah,
Exactly.
yeah.
Can't stress enough, we can't be complacent, so we have to do the proper things, but I really think the panic is over-exaggerated. This is under control. The numbers are definitely exaggerated because we don't know the denominator, but it's probably much bigger, which means, in layman's term, that the mortality rate and the morbidity rate for this virus is probably a lot less than people think it is, and time will show this, just proper when we say proper hygiene, at least 20 seconds, soap and water or alcohol-based or anything, they all work effectively. And try not to touch your face unless you really have to, because that's how basically you get it,
Yeah, because we often touch something, then touch
touch your
our
face.
face.
We're also
Exactly.
guilty of it.
Yeah,
right?
and
Exactly.
we're unconscious to it as well.
I'm
Here
glad you
holding our
mentioned
hands
this.
together right now.
So the virus does stay on hard surfaces for a while, so it's very important things that are high traffic areas, whether it's doorknobs or tables in schools and whatnot. If you wipe them with things that kill the virus, that would really make a big difference.
A lot of times in grocery stores, I noticed that they have things you can wipe the little handle off with, so that's not a bad idea. Maybe even carrying a small container, especially if you have smaller kids, maybe carrying something that can kind of disinfect hard surfaces that they may touch. I think all that stuff is kind of, it's just being vigilant about that.
Yeah. So if you're really panicked about these sort of things, stay home. If not, just use common sense, really.
Right.
Yes.
Exactly.
Even if it's not touching a handrail or whatever, if you're that fearful, wear gloves. Thank you so much for helping us and try and get the word out that no panic, we can handle this. We got it right now. But if things do continue, we'll certainly keep you up to date through the Ohio Department of Health and their website, and of course, keep in contact with Adena and with the Ross County Health District. Thank you again for joining us today.
Dan.
Thank you.
Appreciate it.
And thanks for watching on Litter Media.